A concussion is a type of brain injury. It happens when your head is hit or jolted forcefully. Imagine your brain as a delicate fruit inside its protective shell, the skull. A sudden impact can cause the brain to move rapidly within the skull, resulting in a concussion. This can temporarily disrupt brain function, leading to various symptoms. Concussions are very common, especially in sports and recreational activities. Understanding what a concussion is and how it occurs is crucial for proper management and prevention. By recognizing the signs, seeking timely medical attention, and taking appropriate precautions, we can minimize the impact of concussions and ensure a safe recovery. Concussions are often referred to as mild traumatic brain injuries because they are usually temporary and don't involve any bleeding or bruising of the brain. However, it's important to remember that even a mild concussion can have significant and lasting effects if not managed properly. Identifying a concussion promptly is crucial for proper management. Symptoms can vary from person to person and may not always be immediately apparent. It's important to be aware of the wide range of physical, cognitive, emotional, and sleep-related symptoms that can indicate a concussion. Physical symptoms often include headaches, dizziness, nausea, and blurred vision. Some individuals may experience sensitivity to light or noise, while others may have balance problems or feel unsteady on their feet. These physical signs are often the most noticeable and may prompt immediate concern. Cognitive symptoms can be more subtle but equally concerning. These may include difficulty concentrating, memory problems, feeling foggy or disoriented, and slowed reaction time. In some cases, individuals may have trouble thinking clearly, finding the right words, or remembering recent events. Emotional and sleep-related symptoms can also accompany a concussion. Irritability, mood swings, anxiety, and sadness are not uncommon. Additionally, individuals may experience difficulty falling asleep, staying asleep, or feeling rested even after a full night's sleep. Recognizing these emotional and sleep disturbances is essential for comprehensive concussion management. Concussions can occur due to a variety of reasons, but the underlying mechanism always involves a sudden force or impact to the head. This impact can be direct, such as a blow to the head, or indirect, such as a whiplash injury. Understanding the common causes of concussions is essential for prevention and awareness. Sports-related injuries are a leading cause of concussions, particularly in contact sports like football, hockey, and rugby. Falls are another frequent culprit, especially among young children and older adults. Other common causes include motor vehicle accidents, bicycle accidents, and assaults. It's important to note that the severity of the impact does not always correlate with the severity of the concussion. Even a seemingly minor bump on the head can result in a concussion if the force is significant enough to jolt the brain inside the skull. This is why it's crucial to be vigilant about head injuries, even those that seem insignificant at first glance. Section 4. Diagnosing a concussion, the doctor's approach. Diagnosing a concussion involves a comprehensive evaluation by a healthcare professional. There's no single test to diagnose a concussion, so doctors rely on a combination of medical history, physical examination, and sometimes imaging tests. The doctor will start by asking about the incident, including how it happened, the force of the impact, and any loss of consciousness. They'll inquire about the patient's symptoms, their severity, and how they've evolved. This detailed history helps the doctor understand the potential mechanism of injury and the likelihood of a concussion. A physical examination will focus on neurological function. The doctor will assess the patient's balance, coordination, reflexes, vision, and hearing. They'll also check for any signs of skull fracture or other injuries. This neurological assessment helps determine if there's any impairment in brain function. In some cases, imaging tests like CT scans or MRIs may be ordered. These tests can rule out more serious brain injuries such as bleeding or skull fractures. While these tests don't typically show a concussion itself, they help ensure there's no other underlying condition requiring immediate medical attention. Section 5. The road to recovery, concussion treatment. Treatment for a concussion primarily involves rest and gradual return to activity. The brain needs time to heal after a concussion, and rest is crucial for this process. This includes both physical and mental rest. Physical rest means avoiding any activities that could worsen symptoms or put the individual at risk for another head injury. This may include limiting screen time, reading, and other activities that require mental exertion. Mental rest allows the brain to recover without being overstimulated. As symptoms improve, individuals can gradually return to their normal activities. This should be done under the guidance of a healthcare professional and should be a gradual process, starting with light activities and slowly increasing the intensity and duration as tolerated is key. Medications may be prescribed to manage specific symptoms, such as headaches or sleep disturbances. However, it's essential to consult with a doctor before taking any over-the-counter medications, as some can increase the risk of bleeding. Section 6. Navigating complications, risks, and long-term effects. While most people recover fully from a concussion within a few weeks, some individuals may experience complications or long-term effects. It's crucial to be aware of these potential risks and seek medical attention if any concerns arise. One potential complication is post-concussion syndrome, where symptoms persist for weeks, months, or even years after the initial injury. Symptoms of PCS can be similar to those of a concussion but may also include chronic headaches, dizziness, fatigue, irritability, and difficulty concentrating. Repeated concussions, especially those that occur close together, can increase the risk of long-term problems. These may include chronic traumatic encephalopathy, a degenerative brain disease found in individuals with a history of repetitive brain trauma. CTE can cause a range of cognitive, behavioral, and motor symptoms, and is a serious concern for athletes in contact sports. Another risk associated with concussions is an increased susceptibility to future concussions. Individuals who have had one concussion are more likely to experience another, and subsequent concussions can be more severe and have longer recovery times. Section 7. Prevention is key, protecting yourself and others. Preventing concussions is crucial for protecting yourself and those around you. While not all concussions are preventable, there are many steps you can take to minimize the risk of head injuries. These include wearing appropriate safety gear, promoting safe environments, and raising awareness about concussion prevention. Wearing helmets is essential for activities that carry a risk of head injury. This includes cycling, skateboarding, skiing, snowboarding, and participating in contact sports. Helmets should be properly fitted and worn consistently to provide optimal protection. Creating safe environments is crucial for preventing falls, especially for young children and older adults. This includes using safety gates at the top and bottom of stairs, installing grab bars in bathrooms, and ensuring adequate lighting throughout the home. Raising awareness about concussions and their prevention is paramount. Educating coaches, athletes, parents, and the community about the signs and symptoms of concussions, as well as the importance of prompt medical attention and proper management, can significantly reduce the incidence and impact of these injuries. If you found this information helpful, please like and subscribe for more content on health and safety.